Good afternoon, ladies and gents. My name is Alastair Mordey. I'm the CCO, the Chief Clinical Officer and co-founder of Elevate Health. I'm joined by Simon Lewis, who's the CEO. We're going to explain Elevate Health for you today. It's a reward platform. I think at the end we have time for Q&A. Is that right? Perhaps 5 minutes at the end. Okay, so here it goes. So Simon and I have a background in behavioural health, specifically in addiction treatment. In 2010, we set up a small private rehab called the Cabin Chiang Mai in northern Thailand. It was 8 beds. We started with $100,000 of investment, and in 2016 it was valued at $40 million, and we sold out to private equity and stepped back. During that time, we grew to 120 beds there in Thailand, and we had about 5 or 6 outpatient clinics in the Asia-Pacific region, as well as rep offices in Europe and the Middle East. So we learned a lot about addiction and behavioural health care during that time, obviously. It wasn't just drugs and alcohol that we were dealing with. We also treated a range of other behavioural health issues: smartphone addiction, smoking cessation, overeating, bulimia, anorexia, gaming addictions, and mental and emotional health disorders as well. And what we learned was that whilst about 2 to 3% of any given population are seriously addicted and need to go to rehab, there's about 20 or 30% of any population in any country who are behaving in an unhealthy manner, and moreover in a way that eventually will kill them. So they're not addicts or alcoholics, but they will eventually die as a result of their behavior. Those lead to what we call lifestyle diseases. So lifestyle diseases are mostly driven by smoking, the use of alcohol and other drugs, which is not necessarily addictive, overeating the wrong kinds of foods, heavily processed foods, calorie-laden foods, and a lack of exercise. Those behaviors are now leading to a bit of a disconnect here. Are now leading to 5 or 6 of the top global causes of death. So in the dark blue are what we call chronic non-communicable diseases. That's the same thing as a lifestyle illness. They're the biggest killers in the world. Stroke, heart disease, lung disease, cancers, and the biggest cancers that are killing people are of the lungs, trachea, and bronchi. In other words, they're all smoking-related illnesses, smoking-related cancers, and diabetes, which, as you know, is heavily linked to diet and lack of exercise, etc. So whereas human beings used to die from viruses and infections, waterborne viruses like cholera, for example, now they're dying from behaviours, from their own behaviours. We're dying at our own hands, basically. Disconnect with this. It's not very responsive. I wonder if you could perhaps change the slides for me. Okay. So this is extremely costly to certain key stakeholders. We've got about $1 trillion or more in treating diabetes and pre-diabetic conditions. Obesity is costing the global economy about $2 trillion, so that's not just diabetes, but a range of other illnesses that are comorbid with diabetes. We've got $1 trillion to treat smoking-related illnesses, and not forgetting the inexorable rise of social media and smartphones, which, whilst they're not driving serious chronic diseases, they're driving an epidemic in mental and emotional health disorders, particularly anxiety and depression, body dysmorphia, particularly in the young, and particularly amongst girls. It's also causing a crisis in productivity in the workplace. So I think now you're starting to catch up and see where I'm going with this. These behaviours are very, very costly, and there are certain key stakeholders who are footing those bills more than other people. If you just think, for example, in the UK, the average cost saving if a smoker stops smoking over the lifetime is $6,000. So if there are 9 million smokers in the UK and just 100,000 of them stopped, just think how much of a saving that would be. It would only be about, I think, about 160 or 170,000 people to stop smoking before you start to push up through the $1 billion mark. Okay. So why do humans do these crazy things? Why do we do this? Why do we do rewarding behaviors when they're so unhealthy for us? Well, there's a part of the brain just at the top of your spine called the brain stem, roughly around there, that's very, very ancient, and it produces dopamine molecules. So we evolved to produce dopamine because we need to feel rewarded when we do something that's of survival value. So when you find food or a mate or any majorly rewarding thing which enables your survival, dopamine is produced in the brainstem and shot up to a part of the midbrain called the nucleus accumbens. When dopamine hits that part of the midbrain, you feel pleasure. And it's not just food and sex that make people feel pleasure by dopamine release, it's also money, status, and these kinds of things. The big tech giants like Facebook understand this very well and have manipulated it, famously manipulated it, to great advantage. So that's why people are doing unhealthy things, and that's why they can't stop doing them. What we know as addiction healthcare providers is that if you want people to stop doing rewarding things, you have to give them another reward. So that's when we started to look into the literature, the scientific literature about financial incentivization. So the big thing in health over the next 10 years, it's already started of course, is preventative medicine. And one of the major foundational techniques within preventative medicine will be financial incentivization. In other words, paying people to be more sensible. Okay? So, for example, if you're in any wonder just how much research there is out there on this, there was a meta-study done which found that 9 out of 10 of the studies that were done, and the studies are voluminous, are showing us that financial incentivization works. So pregnant mothers are 3 times more likely to stop smoking if they're financially incentivized. People are likely to lose more weight and maintain that weight loss if they're financially incentivized. Heroin addicts relapse 70% less when they're financially incentivized, and on and on. But one more thing, before I show you how Elevate actually works. When you reward people with financial incentives, it's not enough to reward them once a year or once a month. They're doing that in car insurance, called telematics. You put a black box effectively in the car, and it monitors your driving for a year. If your driving is better, at the end of the year you get a reduction in your premiums, a reduction in the cost of your policy. That won't work for the average person. The average person who's doing unhealthy behaviours needs a regular reward. They need to be rewarded daily, and sometimes multiple times daily. Okay, so here's Elevate Health Reward Platform. So there are 2 key stakeholders. On this side are the customers, if you like. These would usually be large organisations like insurers, governmental health authorities, or large-scale employers. These are people who have a vested interest in seeing behaviour change in a target population. For example, policyholders who are diabetic. They buy the Elevate Health token and reward their citizens, policyholders, or employees to change their behaviour. So, for example, a large Middle Eastern country with lots of diabetes, the health department of the government desires to lower the rate of diabetes. So they buy Elevate Health token and reward their citizens for doing a certain amount of steps every day. And this is the thing with Elevate Health. It's open source, so it's plug in and play. So we will partner with any third-party app, for example, a stepometer app, to monitor that, and then we will pay them for their steps that they've done during the day. They can then cash out that cryptocurrency for fiat, or, crucially, they can use the Elevate Health tokens to purchase health-orientated goods or services. Now this bit's important because we are creating effectively a new market of healthful people, people who've never been healthy before. There are reward platforms out there. They are relatively impotent and not very exciting. They tend to go for the low-hanging fruit. They reward, for example, gym users, people who are already extremely healthy, to get discounts on things like cinema tickets. Not very imaginative, and no possible scale-up there, nothing. We're going for the bottom 20% of unhealthy people that have never been healthy before, and when we reward them monetarily with real money to change their serious health disorders, that is a brand new market of people who are going to buy health-related products. So, for example, it might not just be training shoes, it might also be entrance into half-marathon races. We get brands like Ironman to withhold 5 places in their event for Elevate Health token holders.
Elevate Health is a reward platform. It can be used by organisations, such as insurers, to reward people for healthier behaviours. It's easy to use. The companies simply log on to the Elevate platform, and after logging on, there are multiple M-Health applications available. In this instance, an insurance company is using SoberLink, an M-Health device that monitors alcohol use. A detailed history of all claimants and their alcohol-free status is kept, including rewards earned. A report is generated for each individual policyholder, where all results and rewards earned to date are easily accessible, highly visual, and designed in a way that is maximally rewarding to engage with. Here's Mark. Mark has a history of unsuccessful treatment for his alcohol use. Patients like Mark cost the healthcare system $176 billion a year. But this time, Mark's staying sober by using the Elevate platform in combination with SoberLink. Mark has only tested positive for alcohol 4 times in the last 7 weeks, and he's earned $560. Here we can see Mark using the SoberLink device. It uses facial recognition in combination with a breathalyzer to eliminate fraud. Once a breath sample has been authenticated, a financial reward is paid immediately into Mark's wallet. And here we can see payments being made under testnet with the smart contract platform. And now Mark is back at work. Elevate Health, an unobtrusive lifestyle management platform, allowing people to become healthier and wealthier, all at the same time.
So that kind of also explained why we need blockchain. So what we're envisaging here is multiple payments daily, potentially, for some of these health conditions, in order to maintain engagement and increase the adoption rate. In order for it to work, it has to be gamified. So we have to take a leaf out of social media platforms' book here, and we will be doing that explicitly. So we will tell end users, yes, we are manipulating your brain's reward system in order to help you save your own life. So we're explicit about it, and we're upfront about it, and as you can see, it's quite gamified. So that is essentially a lot more potent than the sort of discounts and rewards that some health reward platforms are currently giving for people who are already healthy anyway. So the team. I've already introduced myself and Simon. Sid is our CTO. As you can tell, I'm not the tech guy from the way that I'm dealing with this PowerPoint. Sid is currently working for Imperial College London's Diabetes Centre in Abu Dhabi. So he's really, really well placed in terms of rolling out large public health campaigns. Mark is the former CEO of Virgin Healthcare and AXA PPP, I believe. Kinder Jackson has extensive history in digital marketing. Darnell was in mergers and acquisitions with PwC, and Garang is from Inverse, which some of you, I'm sure, know already. Social media platform, Adapt, or the second most used DApp in the world, I think. Now, Coincilium are a seed investor and advisor to us. I think a lot of you will know Eddie Travia. So Eddie's sentiments about this project, I think, are partly the originality of it, and partly he knows us and our history and our pedigree in terms of this field and how we can drive adoption because of our networks and because of the way that we operate. So I think in a nutshell what he's saying there is there are a lot of projects in the blockchain space, but not a lot that are actually going to execute. and we will execute. So Coincilium, as I said, are one of the partners. They're an early investor and advisor to us. Fidelity, handling our tech, based in Dubai. Initially, RSK approached us and were willing to put money into the project. Well, initially we were going to roll this out on Ethereum, and then RSK approached us. So we're working with them because we think it's interesting what they're doing. We'll see if they get their stuff together over the next few months. Otherwise, we will continue to roll this out on Ethereum. These are our use cases. Diabetes.co.uk has an app called the Low Carb Program. Now, this is the perfect example of where we come in. It's a great program. It has 10 stages to help people manage their chronic conditions, because chronic conditions don't go away, they're incurable. And people aren't staying on it, they're not complying, they're not finishing it. So this is the classic example of where Elevate Reward Platform comes in. It incentivizes people financially, and it also engages them, and it will pull more of those 300,000 users through the low carb change program than would otherwise make it through. Government of Dubai have a problem particularly with opiate use, so that's not just heroin but also other prescribed but illicitly sought drugs, and also cocaine and methamphetamine. When people are caught in Dubai using drugs, foreigners are deported, but Emiratis are taken straight into treatment to the place called the Arada Treatment Centre. Now they have an excellent new type of technology called pupillometry, which reads the retina of the eye to see if somebody's been using drugs. So the Emiratis who've been caught using drugs are brought to Arada Centre, and if they test negative for drugs from their pupils, from their retina, they will be rewarded by us financially. Soberlink I've already explained in the video. Aboitiz are one of the biggest companies in the world. They're based in the Philippines. They're in the Fortune 2000. We are rolling out 2 use cases with their company with younger employees in Manila, under 30-year-olds, for smoking and for smartphone use at work. So they will be rewarded for sticking to 30 minutes a day of smartphone use whilst they're at work. And again, you can see the blockchain applications with these larger projects. When you don't need people's individual names, you just need to be paying over a large amount of people and rolling the project out in an anonymous manner. So those are our use cases, our tech partners, investors and advisors. I think we have perhaps one more slide. That's us. Okay, that's Elevate Health. Thanks, guys. I'll take any questions you've got. Yeah.
Yeah, please stay. Any question from the audience?
So when you were good presentation, by the way. Yeah. So when you were working as an addiction health professional at the time, what sort of success rate did you see?
Success rates in addiction field are terrible because it's a chronic illness. So, as I said, chronic illnesses, and addiction is one. It's not just stroke and heart disease and lung cancer. Addiction is another chronic illness. It doesn't go away. Once you're an addict, you'll always be an addict. Your only hope is to put the symptoms into remission, in other words, to treat them, which in a horrible way is an awesome opportunity for healthcare providers, because you've got to keep treating them for life. So typically relapse is very common. For example, before I started the cabin in Thailand, I worked for Haringey Council in North London in the public sector, and the attrition rate there was 99%. So for every heroin addict or crack cocaine addict or alcoholic that we took into governmental services, 99% of them would relapse, and we called it revolving door. They come in, they go out. They come in, they go out. The cabin had about 38-39% sobriety rate at 12 months. So we tested at 6 months, 12 months, and again at 2 years. And that's extremely high. 40% is astronomically high. Usually most rehabs would be 5%, 10%, 15%, something like that.
And in terms of the actual users, right, so what percentage are you looking at to say government funded versus privately funded through the insurance companies, etc.? Would it mostly be government to a client here?
Yeah, well, it depends on the customer. In heavily socialised countries like the UK, or even to an extent the Middle East, where the government is very, very well disposed to its citizens, of course there's huge pots of funding available. In the States, it's a different system entirely. In the States, I can see the adoption here, for example, will be through SoberLink, for example. So SoberLink, the breathalyzer device that you saw, is a third-party piece of hardware. It's not our development. So SoberLink is used with parolees leaving prison, for example, because most people leaving prison have substance or alcohol use disorder. If they drink, obviously they're going to commit an offence. So you can readily see how an entire state may well think it's more advisable to put even $1,000 a month into each person rather than risk incarceration, would be more like $800,000 a year per person. The problem there is the prison service is also privately run. But you can see the potential scale, yeah? Yeah.
Thank you.
I know there's no perfect security system, but just reading off CAFE, how do you protect the data privacy of your clients?
Yes, good question. Do you want to answer that, Simon? Simon's got a bit more. Simon's more tech orientated than me. Well, neither of us are techies, I might add.
Neither of us are tech based, but the way that the program has been, or the platform has been developed, is that you can be registered anonymously on it. So if you didn't want your data to be associated with yourself, then you could register anonymously on it, and neither your insurance company or your employer, for example, would know which specific results were linked to that particular
That's certainly the case with Unplug, the smartphone monitoring app that we will use in a Boites company in Manila. Is you don't need the individual, they won't readily sign up to the program if they know that you are seeing what they're doing on the internet. So we don't need it. All they need to do is to see the scale. We paid a large amount of employees over a blockchain to stop using their smartphones. Most of them did, and we rewarded them, and now our productivity's gone up. That's what we need. With SoberLink, it's completely different. It is much more personal. And the way it was developed, it was oftentimes mothers and fathers are buying SoberLink for their child when they leave rehab. Or a parole officer who obviously needs to know who the subject is. So it depends on which app is plugging in, basically.
Oh, one more. One last one.
So on basically on the services side of the business now, the one where you deal with the prisons, etc.
Yes.
What sort of margins are you looking in that business? Because that's different from the other business, which is more a reward system.
Yes.
Maybe a proportion. But in this case, which is services, what sort of margins are you looking at?
In terms of the business model, it's purely an insurance company or a government or an employer enters money into the system, you just take a transaction fee.